What are the best treatments for Achilles tendinopathy? This is cool. Active treatments were superior to wait and see. Okay. What I mean by this is that some conditions in the body, once you get injured, if you just let it go over the course of time, it tends to get better. Right. And sometimes it gets better at the same rate as when we apply physical therapy or exercise or whatever it is. Okay. Achilles tendinopathy is not one of these. So if you wait and see, generally there's a poor prognosis over the course of time. Folks generally don't get better. But if you apply an active treatment, so usually what that means is some sort of exercise intervention, people tend to get better. Okay. So no or limited progress can be expected with wait and see. So if you don't do anything, probably won't get better over the course of time, or you probably won't be happy with the way things go just because there's going to be minimal effect to waiting. Okay. Now, the reason why I think this is important is because a lot of folks with Achilles tendinopathy, they'll just stop doing everything because they're fearful that the Achilles will rupture, right? If they do activities, right? And they also believe that rest is the way to get better. And for the Achilles, this is really not the case, right? Wait and see doesn't work particularly well. So it's important as physical therapists, we educate our patients, let them know, like, yeah, of course, this thing's not getting better. You're not doing much to get it better, right? So we need to make sure that we push an active approach. Okay. What else is helpful for Achilles tendinopathy? Well, this paper showed that education was important, right? And what does education consist of? So education consisted of an explanation of the condition. So maybe chat a little bit about how the Achilles tendon is giving you symptoms and chat a little bit about tendinopathy and what that is. Okay. You want to explain the prognosis. We'll talk about this a little bit later, but you basically want to say you can expect to get better around 12 weeks or so is how long it takes for most folks to start seeing some progress, right? We may not get rid of all of your symptoms, but we will see progress over the course of time, right? And these expectations are super important for your patients because patients constantly want to know how long this is going to take. And if they're not getting better right away, sometimes they freak out and say, oh, crap, physical therapy didn't work for me. There's something more serious might be going on here, or I need to try something different. When in reality, it just takes a little bit more time, and the patient needs to know that, okay? And the other piece that we need to educate our patients about is going to be addressing psychosocial factors and also pain education, right? And the pain education piece is coming from one study in particular from Karin Silbernagel. I think I'm saying her name right. But anyway, she was looking at athletes, right, who had Achilles tendinopathy. And in one of the groups, they had the athletes stop any activity that created pain. In the other group, they had them continue exercising, right? Continuing with their sport. And they kept their pain levels at a 5 out of 10 or less when doing these activities. Anything greater than that, they should stop. And they had them modify activities for the first 6 weeks in the first group, and the other group modified their activities again, but they were allowed to have some pain. What they found is there was no difference in outcome. So generally speaking, it's okay to have some pain when you have Achilles tendinopathy with your activities. And want to probably keep it below about a 5 out of 10. Again, that's just one study. So I'm not sure that that's the gold standard, but at least in my mind, it shows me that, yes, it's okay to have some pain. It's not a bad thing. Let's keep you doing the things that you love and continuing to compete, because we know that if we pull back too much, get deconditioned, and that ends up being a problem long-term as well, right? So educate your patients about how much is okay to push through pain-wise. If we push through too much, that can be a problem. So it's probably a moderate amount of pain that you're able to work through. And if you do too much, maybe makes you worse, right? Lastly, we want to educate our patients about load management. And this comes back to that pain education piece as well. But we may have to temporarily get rid of provoking activities, replace these activities with less painful activities, right? And like I said, so if someone has pain with running and it's extremely painful, we're probably gonna have to pull back, right? At least for me, if someone has pain with, let's say, high speed running, I may just pull back the speed a little bit, right? They can continue to run, but maybe have to keep that at a lower RPE or a lower heart rate range or something along those lines. If I'm an athlete, maybe I can't do sport specific drills, but I can continue to jog, right? Someone that's very, very painful when they jog, maybe we have to take them back to uphill walking or maybe doing an elliptical or something along those lines. But generally speaking, we want to pull back at the beginning of someone's therapy experience, right? Replace the activities with more suitable activities that feel a bit better. And over the course of time, we just slowly ramp up, right? We want to talk to our patients about acute to chronic workload ratios, which basically means that if you throw too much at your Achilles tendon over what it's used to, you're more likely to flare it up. Okay. So over the course of time, we're going to back off of provocative activities and we slowly start to ramp up the stress on the Achilles over the course of time. Again, we can use that 5 out of 10 as a guideline for our patients. Okay. And here's the other piece. So when we were looking at the best treatments for Achilles tendinopathy, most of these studies were mid-portion Achilles tendinopathy studies. There are only 2 studies that were looking at insertional Achilles tendinopathy. So we don't know whether or not these guidelines are actually going to be effective for insertional tendinopathy. That's our best guess based on the research we have right now, right? So here's what I want you to do next, guys. If you enjoyed this video so far, I have an entire course. It's free. It's called the Fitness Pain-Free Mini Course. And we go over 3 lessons going to help you take a lot of this information that we went over so far and put it into practice. The first lecture is called Why We Need a Better System. So first and foremost, the way we treat fitness individuals, all right, athletic people in the gym from a physical therapy perspective is pretty much broke, okay? So we need a better system to serve the folks that are in the gym that get hurt, they want to get back to training, all right? Lecture number 2 is called 7 Reasons Why People Get Hurt in the Gym. And essentially, we have to know the reasons why people get hurt in the gym so we can keep them safe in the future, right? And when they get hurt, we have to know why and how to get them back to training in the gym. Okay, so a thorough understanding of this is very, very important. I actually have a really cool infographic that goes along with this lecture that you get for free as well. And lastly, we go over a case study of how to get someone out of pain and back to training. So these principles are all phenomenal, but we don't actually put it together and you don't understand how to create a program to get people back in the gym and keep them safe for the long term, then we lose, right? So I'll put a link in the show notes for this. It's a Fitness Pain-Free Mini Course. Definitely check this out.